Stroke is a neurological disorder characterized by blockage of blood vessels. That means clots form in the brain and interrupt blood flow, clogging arteries and causing blood vessels to break, leading to bleeding. It leads to sudden death of brain cells and lack of oxygen to brain tissue. The stroke is referred as the brain attack. It is also known as cerebrovascular accident. A stroke is a medical emergency that can result in death or irreversible neurological damage. Stroke is the second leading cause of death globally. It affects roughly 13.7 million people and kills around 5.5 million people annually. There are mainly two types of stroke are there: ischemic stroke, hemorrhagic stroke, and another type of stroke is transient ischemic attack, TIA. Ischemic stroke represents 87% of all strokes. A portion of the brain cannot receive blood or oxygen because of a blood clot. The arteries that provide blood to the brain become blocked or narrowed in this type of stroke due to the presence of plaque. As a result, there occurs ischemia or significantly reduced blood flow to the brain. A common cause of ischemic stroke is presence of blood clots or fatty plaque. Hemorrhagic stroke can be caused by leaking or burst of arteries in the brain. Blood can leak from blood vessels that have burst into the brain or close to the surface of the brain. The blood may also enter the space between the skull and the brain as a result of this. A blood vessel can leak or burst from a variety of reasons, including having hypertension, being physically injured, taking blood thinning drugs, or having an aneurysm, etc. The most frequent type of hemorrhagic stroke is intracerebral hemorrhage. The transient ischemic attack occurs when there is a temporary interruption in the blood flow to a specific area of the brain. It is also referred as mini stroke. The symptoms of transient ischemic attack are just momentary, but people should consider them as medical emergency. And they serve as early indicators of future strokes. If untreated, within 3 months of having a transient ischemic attack, approximately 10 to 15% of patients will experience a severe stroke. Risk factors of stroke. There are mainly two types of risk factors: non-modifiable risk factors and modifiable risk factors. Non-modifiable risk factors. The risk of stroke increases with age and doubles over the age of 55 years in both men and women. Women are also at equal or greater risk of stroke than men irrespective of their age. People with a dark complexion are at higher risk of stroke than white population. And genetics contribute to both modifiable as well as non-modifiable risk factor for stroke. And people with history of stroke also more prone to develop strokes. And the modifiable risk factors. The major modifiable risk factors for stroke are hypertension, diabetes, lack of physical exercise, alcohol and drug abuse, cholesterol, diet management, and genetics. Hyperlipidemia is a major contributor to coronary heart disease. In turn, it leads to stroke. Tobacco smoking is also directly linked to increased risk of stroke. The signs and symptoms of stroke. An unexpected inability to talk clearly or understand communication. The person will be in confusion. Paralysis or numbness of the face, arm, or leg. Body weakness or paralysis will develop on one or both the side of the body. To check this, try to raise both the arms at a time, and if one arm begins to fall, you may be having a stroke. One side of the mouth may droop when the person tries to laugh. An unexpected problem with one or both the eyes vision, or sudden blurring of the vision will be there. Sometimes the person have severe headache, possibly accompanied by dizziness or nausea, falling without an identifiable cause. The person also have trouble walking, including a loss of coordination and dizziness. The person also has issues with bowel or bladder control, difficulty controlling or expressing their emotions, confused state. In short, warning signs of stroke to remember easily are: first, face drooping, arm or leg weakness or heavy leg or arm, speech difficulty, time to call for ambulance. There are different types of diagnostic test which helps to determine the type of stroke, including physical examination, blood test, CT scan, MRI scan, carotid ultrasound, cerebral angiogram and echocardiogram. Preventive measures of stroke. 90% of all strokes are preventable, and there are 10 modifiable risk factors. If we control these risk factors, we can protect ourselves from getting stroke. The first and foremost risk factor is hypertension. High blood pressure can be controlled by following DASH diet, the dietary approaches to stop hypertension. In this diet, we need to restrict our diet up to 2000 calories per day. And this diet should be rich in protein, nutrients and fiber. And the diet for prevention of stroke also involves eating of lots of fruits, vegetables, lean protein, whole grains and foods that are low in added salt. We need to consume whole grains such as brown rice, oats, quinoa, barley, etc. Legumes such as beans, peas, lentils and all varieties of dal. Consume lean proteins such as chicken, tofu, eggs, peas, etc. Oily fish such as salmon, sardines or herring fish, etc. And always opt for unsaturated fats. Example, olive oil, avocado oil, etc. Consume low-fat dairy products such as yogurt or low-fat milk. Include all varieties of nuts and seeds. And consume diet which is rich in fiber. Example, oats, spinach, potatoes, strawberries, lentils, almonds, banana, orange, corn, whole meal bread, chickpeas, green peas, quinoa, broccoli, apple, etc. Additionally, the diet also should be rich in potassium. Example, tomato, water, melons, banana and green leafy vegetables. Calcium rich foods also must be included. Example, milk and milk products, green leafy vegetables, etc. Diet rich in magnesium. Example, nuts, almonds, legumes, green leafy vegetables, brown rice, banana, etc. In addition to the DASH diet, we must also avoid intake of salt as well as bad fats in our diet. Bad fat includes fried foods, ice creams, cheese and fatty meat, etc. Because these bad fats increase the risk of hypertension as well as stroke. In addition to the diet, we must also maintain adequate hydration. Drink plenty of water, at least 10 glasses of water per day. Always limit or avoid drinking of carbonated sugary drinks. Example, all varieties of energy drinks. Example, Coca-Cola, Pepsi, Fanta, etc. And avoid alcohol also, because alcohol contains a lot of empty calories which will affect the normal functioning of the body. And also avoid eating foods from restaurants as they contain more of trans fats to make the food tastier, and limit the intake of beverages like coffee. In addition to the dietary changes, we must also involve in regular exercises. These exercises helps to maintain active lifestyle and they help to reduce the risk of diabetes, high blood pressure, high cholesterol and other conditions which increases the risk of stroke. Avoid either first hand or second-hand smoking. And always manage stress. Stress can be managed by managing our time properly and practicing meditation every day, spending time with nature, listening to music, reading to favorite books, talking with friends through exercises, and by positive thinking. Get enough sleep. At least 6 to 8 hours we must rest our body. In addition to all these lifestyle modifications, be aware of family history, because if any one of the family member is suffering from stroke, there is a possibility of getting stroke for us also. So always aware of family history. Consult physician oftenly and check for blood pressure, cholesterol, weight, diabetes, etc. And take the medications regularly as per the doctor's advice. Avoid over the counter medications. Always seek doctor's advice.